Hello everybody, my name is Dr. Emery Pitcel. I am the owner of Rothrock Chiropractic and Rehabilitation. We are a chiropractic office here in State College, Pennsylvania. If you are a patient of ours and you've had a mid-back issue, you have likely been given the McKenzie Method cervical and thoracic spine exercise packet. On the back page, this is going to be the top exercise called McKenzie standing extension over a foam roller. And if you aren't a patient of ours and you happen upon this video, we hope that this helps you, that you find some pain relief with it. And if it does help, leave a comment or a like or subscribe to the channel. Share this with somebody who might need help. But hopefully this is a good review for our established patients if this was your prescribed exercise. So for this, you are going to need a foam roller. It doesn't always have to be this long. It could be about, half that length right there. But you're going to use the foam roller and we're going to put it onto the wall. What we try to put the foam roller is close to the segment that is bothering the patient the most. So if it's more of an issue between the shoulder blades, then we aim to put the foam roller a little higher. If it's more in like the mid back, then obviously go a little lower. I'm going to demonstrate something that's right at the bottom of the shoulder blades here. You give yourself a nice stable base, feet maybe a foot apart and about a foot in front of where the foam roller would drop down if it was on the wall there. The important part is to get the tissue slack out. Now, you could get some leverage by just stretching over it like that. But if you put your hands on top of your head, or at least try to have the elbows kind of pulled back like this and the arms back like that, then you pull all the tissue slack out and you get direct line of drive and movement right into the thoracic spine and the muscles. So from there, we start to just arch our way back over, holding for 1, 2, and come back forward. Come back to a neutral. Don't curl all the way back like this, but pulling back for 2 seconds, return back to neutral. It's important to stay within pain tolerance. So if while doing this exercise, we're starting to hit a little bit of pain, but that's a 4, and you're like, I could go a little further, but it's going to hurt like a 6, don't go pushing it into a 6. Ideally, what's good with these is to do them 5 to 6 times a day. That's like every 2 to 3 hours while awake, doing sets of 10 to 15. Since there isn't a lot of movement in the mid back relative to the neck and the lumbar spine, that's why it's important to use like a foam roller to create leverage and overpressure. This exercise certainly could be done, same concept, down on the floor. The reason why we like the wall is twofold. One, it actually is a little more controlled, so a patient is less likely to overdo it. And two, actually with everything kind of being braced and supported, you actually do get a little bit better line of drive and strategic move through the joint segment, versus the foam roller on the floor is a little bit better for kind of just moving and overstretching the muscles and not as targeted and good for getting after the joint segments. So what patients are we prescribing these exercises for? Although it's only 2% of the time, thoracic discs issues do happen. So this is a great exercise typically for that. If we have a rib out of place, this is typically going to be a pretty good exercise to walk that rib back from posterior to anterior. And also probably like a thoracic strain. So something like a strain on the rhomboid or on the lat, getting that stretch going to this direction a lot of times is very beneficial and favorable. So again, we hope that this video was beneficial, a helpful review for our established patients. And for those out there, if this does, that aren't patients here and it does provide relief, we're happy for you. Make sure you subscribe and leave a comment if it's beneficial. Thank you so much for watching, everybody. Take care until next time.